Welcome, it's Charter Local Edition. I'm Brad Pomerantz, and we are joined today by Brad Jacobsen. He is a member of the Michigan House of Representatives. And sir, I understand that the state of Michigan has one of the highest, if not the highest, auto insurance rates in the nation.
We are one of the highest in the nation, but we also have the best benefits. So I guess there's a trade-off we need to look at there.
And let me ask you, if I may, because obviously the key trade-off is the following. If there is an automobile accident and someone has injuries that last a lifetime, they will receive lifetime benefits through what's known as the Michigan Catastrophic Claims Association. Pluses and minuses to that.
Well, that's true. If we look overall, Michigan has, to back up a little further,
please.
Michigan has what we refer to as a no-fault state. No-fault insurance. And it was instituted back, I believe it was in the late 80s. And there's been a public vote once on it to try to do away with it. And the people at the time voted overwhelmingly to continue our no-fault program. It was instituted in part because there were so many lawsuits filed over car accidents and injuries that injured individuals were not getting the care they needed because they were fighting lawsuits over their bills and not getting the necessary care at the time, and crucial care right at the beginning of any injury is vital.
Of course.
So the state instituted no-fault long before I was here. And as part of that was formed the Catastrophic Claims program. So if you do if you have a long-term injury, quadriplegic, bedridden, for whatever needs that you're able to not able to carry on normal functions and need continuous medical care, you are covered. So your regular insurance company will cover up to, I believe it's $580,000. $530,000. And then after that, your bills get kicked over ultimately to the Catastrophic Claims Association.
And as I understand it, that association, it receives its funding through a per vehicle assessment of $186.
Correct.
And that adds more costs to insurance bills, which in some communities can be as high as $3,000, $4,000 a year. And the challenge with that is, if you live in Detroit, for example, where the average income is $25,000, $26,000 a year, you're being asked to pay a very significant portion of your yearly income just for auto insurance.
Sure. The insurance is overall, as we discussed right at the very beginning. Michigan is very high on our insurance, and we do have that additional catastrophic claims assessment, which goes up and down every year based on how many people are injured in that year that would require those services, how many people unfortunately may have passed away who had been receiving those services. And there's a complex formula. In fact, I'm helping co-sponsor a bill that is going to take and look at, it's a new one that we're just getting ready to introduce, that will try to force the Catastrophic Claims Association and its insured members to make their actuarial numbers available to us. Right now, it's a semi-private organization, and there's a lawsuit pending right now trying to get more of their records. So we're really trying to figure out how they figure those records out, and if the approximately $18 billion they have in their fund is adequate. Is it too much? Should we still be paying our $186, or is there enough in there to cover the injured people that are in the program right now?
But here's the question. Should Michigan look at creating a lifetime cap? We know with the Affordable Care Act and health insurance, the lifetime cap is gone. But when it relates to an automobile claim in this state, what's your sense?
Well, right now you're right. There's no cap on it. So if you were injured, you get this lifetime benefit. Pretty much all your medical needs are covered. If we do away with the cap, I'm very uncomfortable with capping the services of those who are already in the system.
I see. Don't change the rules
midstream. So we don't change the rules for those individuals who are already in there. For the people who come in new, perhaps we should have a cap. We've kicked it around. I've been looking at this for 3.5, 4 years.
If not more.
Right now, this is a new iteration we're looking at.
But, sir, if that happens, what happens to the paraplegic? Someone's going to have to pay for their bills after that cap is reached. And that someone could likely be Healthy Michigan or Medicaid. And so it winds up we all pay anyway. So is that the road we want to take?
Good question.
Good question.
I don't have an answer.
And that's fair.
You know,
very fair.
We've been looking at setting a cap, and forgive me, I won't have the 100% correct numbers, but we've looked at a $3 million cap. We've talked about a $5 million cap. We've talked about an $8 million cap, as opposed to no cap whatsoever. Right. As cruel as it may sound sometimes when you're talking about people's lives and their injuries, most people who are in a catastrophic situation don't survive more than 15 years after their injury.
Right. No, I understand.
So if the actuarial table numbers they're using, say 15 years calculation, that $18 billion may be enough. If their actuarial tables say, well, we're carrying out to 65 because or 80 because most people live close to 80 now, that's probably not a realistic actuarial. So, but back to the cap for a minute. We keep looking at that, and when you look at the people who are injured and in that, very few of those individuals get beyond $3 to $5 million in total care in their lifetime. Right. So unlimited, who knows? There's very few individuals who've ever gotten close to 25 million. Right. So we could probably ratchet it in, but you're correct. If they go over that cap, what happens to them? They get kicked into Medicaid or Social Security or Medicaid, Medicare, some other program, which ultimately does come out of our pockets.
Here's the question though. As I understand it, one of the reasons why auto insurance rates are so high is because the automobile insurers don't have the ability to pre-negotiate medical rates like the health insurers do, even though they're likely the same company. Is that something that the legislature can look at to allow auto insurers to pre-negotiate, or maybe have the health insurers pay the claims first if it's a health claim related to an auto accident?
All of those things are that we are looking diligently right now. Speaker Pro Tem Leonard is chair of the insurance committee, and I meet with him. I talk to him almost on a daily basis about the issue. If not, we have a major meeting usually every Thursday morning with a group of us that are working towards this end. So we're looking at all the different aspects. A little bit of the concern I have right now on all of the things we've been working at, I mean, we'd like to reduce our insurance rates that we all pay as drivers. We'd like to try to put a cap on medical expenses for, most of the Michigan residents have seen some kind of advertising that says this little tube of ointment costs $1.29 at the local big box store that sells healthcare products, but if you get the same tube in the hospital, it costs $37 as opposed to $1.29.
And that's the problem with the pre-negotiation.
We try to control those things and look at it. But I have a deep-seated concern in the back of my mind that after all this work we're doing on it, unfortunately, I'm not sure with the existing NoFault, the way it happens in Michigan, that we're really going to save the drivers any money or the healthcare on healthcare expenses at the end. I certainly hope I'm wrong, but the more I study it, the more I look at all the different angles on it. We all want the best healthcare. We all want the newest, most innovative, life-saving program we can have. So do we tell the hospitals that when there's an EMS run with an injured person coming in, don't call the #1 brain surgeon you've got on staff? How do you make those calls?
His name is Brett Jacobsen. He is a member of the
Michigan
House of Representatives. My name is Brad Palmer. It's his Charter Local Edition.